Moderator Ezra, our friend and partner. He also knows a lot of, he also member of Jewish Orthodox Chamber of Commerce and CEO of Friedlander group, and he worked 25 years in government relations and also here on Capitol Hill. So I'm sure he knows a lot of issues about Israel and also about foreign policy on Ukraine.
We're going to be focused on the humanitarian situation in Ukraine, which I think, to me personally, is more important than anything else to understand the human suffering. We all, numbers, casualties, but unfortunately, there's a real human dimension behind every casualty, every person who's wounded, every family that's impacted by the war. It's easy for us to pontificate here in Washington, D.C., but obviously when it impacts people on the ground, it's more, it cries out. With me, I would like to introduce Anna. I'm probably going to mispronounce your name, excuse me for that. Anna Yabluchanska? Okay, close enough. Who's the director of the medical aid program of United Help Ukraine, 501c organization receiving and distributing medical defense, food, and other supplies directly to Ukraine since 2014. Anna is a board member and director of the medical aid program and assists in other projects. Anna brings extensive experience from the private and public sectors in Ukraine, the nation of Georgia, and the United States. She's actively engaged in cancer research at a global company and is a devoted parent of triplets. Thank you so much for your participation. I knew that would receive, people would react to that. Thank you. Roman Palchykov, founder and chairman of the charitable foundation, the first fund for the restoration of Ukraine, dedicated to rebuilding and strategic recovery. His work centers on state and regional policy, construction and restoration, and internal strategic communication. Mr. Palchykov is a seasoned expert in public administration, emergency services, and regulatory policy with over 2 decades of service in Ukraine's Ministry of Internal Affairs, Ministry of Emergency Situation, and the State Emergency Service. Thank you both for your participation here today. Anna, let's start with you. Based on your frontline experience, what are some of the most urgent humanitarian gaps in Ukraine, and how have faith-based groups uniquely responded to those challenges?
Thank you so much. Can you hear me? Is it
Yes.
Okay. It's a pleasure to be here, and it's very important to say and to understand that war, unfortunately, it's not only about geopolitics. It's about people. People, their life, their homes, their families, their health. What we see now, thousands and thousands of people are being displaced in Ukraine. Many of them lost their homes forever, unfortunately. Many of them lost their relatives, suffering with physical illnesses and wounds and mental health. And we are, as a non-profit organization, of course, as a first point, we are facing to humanitarian efforts. I'm in charge of medical aid program. We are dealing with patients who are being wounded. So we work with hospitals across Ukraine, supplying them with essential medical supplies, equipment, and medications. Over 200 hospitals are being supplied daily by our team on the ground. And it's done because of collaborative work of United Help Ukraine and our partners, as one of them we see here is a Project Cure and many others as well. So for us, it's very important to understand that when we work as a team, it's crucial. We are providing assistance in mental health, and we were lucky to meet some Israeli psychologists at the beginning of the full-scale invasion who brought to Ukraine a very interesting toy, therapeutic toy called hibuki, which was used to provide mental health assistance to children suffered by war. And we did trainings for the families and psychologists to work with them. And we even established production of hibuki toys in Ukraine. And over 700 toys were distributed in Ukraine for children. It's very great to see how these like tiny, small efforts can bring joy to children. Also, and then this project grew to a new one, which we called Smuga. We're providing mental health assistance for families with children who are suffering from war. And we have several hubs across Ukraine, and we're also providing trainings for psychologists because we understand that this nation should survive after the war is over. So for us, it's very important to keep people healthy and mentally healthy. Also, we are supporting a lot of medical efforts on the ground. One of our partners in Ukraine, it's called FRIDA, it's Israeli-Ukrainian Medical Association. It's a group of doctors who go to the front lines and provide medical assistance and help for those who don't have access to any kind of medical help right now. And we are cooperating with this team for over for almost 4 years now since the full-scale invasion. And we see that such kind of collaboration really, really helps. We are seeing how religion and churches not only provide like faith, but they also like provide humanitarian assistance. We are cooperating with a lot of rabbis in Ukraine who are working with communities over there and providing mental health, humanitarian effort, and medications as well. So we are happy to assist them in these efforts. So additional to that, we are working in the United States, bringing wounded warriors here for rehabilitation. And currently we have 3 very severely wounded patients who are undergoing treatment in the United States. And as I say, so just being as a team, uniting by countries, uniting by organizations, we are able to do a lot. So, thank you.
Thank you so much. Appreciate it. Thank you.
Thank you.
Roman, we'd like to ask you, how can strategic recovery efforts incorporate spiritual and communal healing? Do you see a role for interfaith cooperation in Ukraine's reconstruction process?
Наразі відновлення України розвивається дуже семимильними кроками, скажімо так. Чому? Тому що попри те, що багато будівель зруйновано, нанесено великої шкоди енергетичній інфраструктурі. Минулої зими Україні було завдано багато збитків в цій сфері, але завдяки героїчній праці Збройних сил України, рятувальників, енергетиків, Україна не поринула в темряву.
I can say that the recovery is moving very quickly. Why? Because now we restore a lot of buildings destroyed. The energy infrastructure, especially this winter, was heavily damaged, and there were a lot of work this winter. There were a lot of destruction. But we can say that the heroic work of armed forces of Ukraine and energy workers helped to restore, and there were no dark in Ukraine.
Попри великі виклики, які стоять перед державою, громадським суспільством нашим, Україна вже має певну візію, як можна відбудувати і відродити ті сфери, які дуже сильно постраждали, ті регіони, які дуже постраждали. Розвиваються певні програми щодо відбудови житла. І одне з факторів таких дуже важливих і дуже цікавих, те, що дані програми в своїй основі мають певні риси, які намагаються відбудувати все, що було зруйновано, краще, ніж було. Build better. Sorry.
So we have very big challenges, but the state and also the society, they have a vision how to move go on, and we have a vision how to rebuild the spheres that were destructed, also the regions that received the most damage, and we have a special program to rebuild the residential building. And the main focus of this program is to build better than it was before.
Але одною з величайших проблем, яка заважає відновити ті регіони, які дуже постраждали внаслідок війни, це дуже щільна замінованість і забрудненість залишками війни територій.
But one of the main problems that make obstacle to restore the regions that were heavily damaged is the big demining, and there are a lot of regions that have a lot of consequences of war.
Тому одним із основним та першим кроком має бути проведення розмінування звільнених територій, які захаращені вибухонебезпечними предметами. На початок війни, за офіційними даними, території, які були забруднені вибухонебезпечними предметами, сягали площі 174 тисяч квадратних кілометрів. А це площа таких держав, як Сирія, Камбоджа або площа такого американського штату, як Флорида.
One of the main steps is to provide demining territories that where the war has been, and on the beginning of the war they were estimating that the territories that needs to be demined is 174,000 square kilometers. So it looks like Syria, Cambodia, or US state or Florida.
Тому виклики, які стоять перед українським народом, дуже великі. І завдяки нашим партнерам іноземним ми впевнені, що ми дані виклики подолаємо.
So we have big challenges that standing with the Ukraine. They're really big, but we are sure that with the help of foreign partners, we can deal with these challenges.
Завдяки розробленим програмам урядовими та неурядовими органами, а також іноземними партнерами, наразі в Україні проводяться певні програми щодо гуманітарного розмінування території і в подальшому відновлення даних територій, розбудова їх та повернення до цивільного життя.
With the help of programs as government-led, also with the help of NGO and with foreign partners, Ukraine is making humanitarian demining and moving to restoration of these territories, and the aim is to return these territories to normal civil life.
Thank you. I'd like to for us living here in the US, we read about Ukraine almost on a daily basis, but what are the numbers? How many wounded? We hear the president reference 5,000 troops are being killed on an average on a weekly basis. In terms of the injured, the human cost, what numbers are we talking about? How many injured soldiers are there? How many injured? What are the casualties? If you could just run us through, so behind every number there's a human being. If you can just elaborate on that.
Я не можу вам...
I'm sorry,
Це не до мене питання, вибачте.
I apologize.
This is actually a very tricky question because for safety reason, Ministry of Health does not distribute this information. But what we've had on the data back in 2023, at the beginning of the year, we had information about 50,000 amputees in Ukraine. So 2 years ago, 50,000 amputees. So, and we know that current war is a war of drones. So we have, this war is absolutely different from what we had before. So the number of such kind of patients we have more and more. And even worse, like one of the topics we are working with is a tactical medicine. So we are training our soldiers who, like, very often they didn't have any military backgrounds. They're just people who were like went to serve to their country. And they were learning how to use tourniquets. We all hear about tourniquets, that we all need tourniquets. So up to 40% of all amputations happened because of the tourniquet syndrome. And tourniquet syndrome is acute ischemia of tissues which was developed due to incorrect usage of tourniquets when it's not needed and because of long evacuation. Unfortunately, it's not the US Army when there can be patients can be evacuated in 30 minutes. Sometimes our soldiers wait for evacuation for several days. And this is a very, very sad picture. And what's, I think, modern, like, next wars will be different from all the previous. And what Ukraine shows now, that starting from this point, evacuation will never take 30 minutes in any further time, just because it's a war of drones. Drones won't let the helicopter to land to pick up a patient. So we all need to use this experience and think what to do next and how to save people in all our future conflicts, unfortunately.
Thank you. That's a scary number. Let me just put it to you this way.
Я хотів би додати, що я не можу казати за дані військові, але я можу привести дані жертв, які постраждали від вибухонебезпечних предметів вже на мирній території. Це загиблих 330 людей і більше 1100 людей цивільних, які постраждали. Серед них діти, цивільні громадяни. Це, ще раз наголошую, це там, де територія вважається безпечною. Але враховуючи те, що наразі Росія застосовує ракети з касетними бойовими частинами, я хочу сказати, що безпечної території на Україні взагалі нема.
I would like to add, I cannot say about the military figures, but I can say that on territories that are considered as peaceful, we can say that there were killed 330 people and 1,100 were wounded. So these are civilians and these are children. And I would like to say that this is territories that are considered to be safe. They are considered to be peaceful, but Russia now sends a rocket, so in any territory you can get explosives after such a rocket.
Thank you. Thank you. Let me ask both of you a question. What best practices or lessons can be shared about preserving the dignity, sovereignty, and family values in humanitarian aid, especially in complex environments like Ukraine? Anna, let's start with you.
Well, we all learn on the go. But what we definitely see is that we all should remember that behind all the story is a human life. So as soon as we respect person, life, health, that's what will bring the most important, I guess, in all our future efforts.
We have any questions from the audience? Would be anyone ask the question?
For Latinos United for Conservative Action. So it's come to my attention over the past couple of days that not only is North Korea sending people to fight, but also Cubans. Is that something that you also help with when it comes to humanitarian aid? Because from what I understand, there's been over 300 Cubans that have since passed away alone. And I wanted to know your opinion on that and if there was anything else that maybe we aren't aware of. Thank you.
Well, we of course, any other soldiers that will be influenced to this war will cause more damage and more destruction. So, of course, if there are more, like 3,000 soldiers additionally will be participating, we're expecting more wounded. So, for us, we will need to bring more evacuation vehicles, equip them, help hospitals, send supplies, train medics on the ground. We used to train medics, frontline hospitals in first 2 years of war for mass casualty events preparedness plan. And we trained 46 hospitals along the front line. And this is probably something that we will need to think about again and take these trainings back. Because if we will have more casualties, we will need to keep hospitals prepared. Thank you for your question. It's very, very difficult one.
Ну, я думаю, ми всі розуміємо, що залучення найманців або ідейних комбатантів до бойових дій з російської сторони з інших держав, це свідчить про те, що це початок Третьої світової війни, і мені здається, що жодна країна не залишиться осторонь.
We all have to understand that Russia is using mercenaries and or combatants who got idea from Russia, and all this mean the starting of the Second World War, and no one live outside.
Thank you.
Yeah, I had a question about the media. This is war, so what type of media is actually telling the story, or journalism? You know, every history has a story. Is this story actually being told? Can we trust the media, the journalists that are getting into behind enemy lines? What type of media is actually getting in behind enemy lines to tell the story? Do you have that information?
Can I invite? No.
So I'll introduce myself. My name is Ezra. I'm Voice of America. I'm editor-in-chief for Ukrainian service. I'm here in personal capacity because Voice of America is being on administrative leave. In terms of media coverage, the war of Russia against Ukraine is probably one of the most televised. It's happening right in front of our eyes. There is a lot of videos on social media. There is a lot of video which are obtainable through satellite, for recording from drones. Some of the people who are in the trenches, they also, will also receive some of the sort of like user-generated video, but it's actually from the soldiers. So there's a lot of journalists, especially in the beginning of the invasion, who came to cover the war and Ukraine. And I actually talked a lot. I did a story, and I did a round table with reporters talking about the experience, how they work in Ukraine compared to other conflicts that they covered as a professional war reporters. And they were telling there's one thing which is much easier than situations, say, in Iraq or Afghanistan, is because they found it's very easy to work with Ukrainian authorities. They found it's easy to find a nice connection, to find a good hotel. They found that Ukrainian society is very open. They share their experiences. So people share the most painful stories. What they found is the most difficult, and it's much more deadly than what they experienced in Syria, Afghanistan, Iraq. You cannot report right from the trenches on so-called zero line. There are no reporters. Occasionally they come, they do a little bit of stories, but it's not like you can go back and forth through the trenches and do it from both sides. It's heavily mined. It's somebody mentioned Verdun. this is something what's happening in Ukraine right now. So that's kind of an answer. But of course, they should be, maybe people don't hear enough about the war, not because the war is not happening, but because some of the media prefer not to cover it or not interested in covering it, they don't want to broadcast those news. But it's excessive.
Do we have any other questions?
And I'll just add that maybe there are a lot of stories that never happen to go to media. Like, I just came back from Ukraine last night, and last week I was in one of the hospitals, so like we are supporting with a lot of different stuff. And then there was one patient, a lady who got wounded after one of the recent strike on Kyiv. Her building was destroyed, her husband unfortunately died, and hospital arranged her, like she is bedbound. So hospital arranged an ambulance to let her go to the funeral of her husband and took her back. So unfortunately, there are a lot of besides the scenes that we do not see, but unfortunately happens.
Thank you so much. Okay, if anyone has a question, this is your time to speak up. Okay, thank you both. Really appreciate your participation. And I guess the next panel will be in 5 minutes or so.